Good afternoon, everyone. This is Karadina Sale from the McSilver Institute, along with the Community Technical Assistance Center and Managed Care Technical Assistance Center of New York State. Thank you so much for being here today for our webinar on problematic sexual behavior. This webinar will discuss guidelines as well as some of the best practices regarding treating problematic sexual behavior. Because as we know, with proper intervention, children with problematic sexual behavior often do not continue to have these issues into adolescence and adulthood. I really want to thank our trainer today, our presenter, Jenny Almanzar, who's an LCSWR, and who's also the director of the Sexual Abuse Treatment Program at the Family and Children's Counseling Service Center in Binghamton, New York. I've already learned so much from Jenny, and so I'm really grateful for her and her expertise and for sharing it with you all today. Just as a reminder, everyone is muted, so if you have questions throughout today, you can chat them to all panelists so that we make sure everybody gets them and we track them and we can review them at the end. If there are any resources, they'll be posted in the chat box or at the end of the slides. And there is a short survey at the end just to make sure that we have presented a good training for you, and we do look at all the feedback, so if you could just complete that, that would be amazing. And then the slides and the recording, the resources will be up on our website at ctacny.org. And also, most importantly, thank you all so much for all you do. You are all essential workers as we continue to get through this pandemic together. So thank you for being here today, and I will pass it over to Jenny.
Good. Good afternoon, everybody. Let's see. So let me just get you going here. So I'm just going to tell you a little bit about myself. So I am the director of, we used to be called the Sexual Abuse Treatment Program. We actually just changed our name to the Journey Project. We wanted to be more trauma-informed, and we wanted our clients to feel less stigmatized when we reached out to them for services, for sexual abuse. We are a sexual abuse treatment program, and what that means is that we treat the entire family who's been impacted by sexual abuse. And we treat child victims and their caregivers and their siblings, and we also treat children with problematic sexual behavior, which we're going to talk about today, and adolescents and adults who had illegal sexual behavior. So we do all of that here. Today we're going to focus on children with problematic sexual behavior, and those are going to be children between the ages of 7 to 12. This is a population that is growing, unfortunately. And so we like to really get this information out there so that people can understand the population better and also help to get them the correct services that they need. So we're going to talk about what it is and what it means. We're going to talk a little bit about how to respond to children with problematic sexual behavior and illegal sexual behavior. And then we're also going to talk a little bit about kind of an overview of treatment needs for this population. So what are some people's thoughts about problematic sexual behavior? And you can go ahead and chat that, because I kind of like to know as we go along, if anybody has specific questions that they want answered so that I can cover that. But we are going to do an overview of this population. So if you do have any questions, you can go ahead and chat them, and we'll kind of look over at that a little bit. Okay. So as we go along, what I want you guys to think about is some of these commonly held beliefs about this population. So I'm going to shorthand this. If you hear me say PSB, that is children with problematic sexual behavior. It's very long. So if you hear me say PSB, that's what we're talking about. So these are some commonly held beliefs. Children with problematic sexual behavior must have been sexually abused. Children with problematic sexual behavior need to be removed from their homes and can't live with other children. Children with problematic sexual behavior are mini sex offenders and will become adult sex offenders. So again, these are just some of the things that we commonly come across, or thoughts that people have about this population. So keep that in mind as we go along this presentation. And yes, we are definitely going to be talking about the differences between what's normal sexual behavior and what's problematic. I know that's a question that someone had. Feel free to ask questions along the way. I will try to answer them as I go, but we might have to hold some of them till the end. So where do problematic sexual behaviors come from? So I think one of the main commonly held beliefs that we hear is that they must have been sexually abused themselves. And in fact, there isn't one type of child who develops problematic sexual behavior. It can be boys, it can be girls. Boys, we do tend to see a little bit more exhibiting problematic sexual behavior, especially in this age range, 7 to 12. Interestingly, in our preschool populations, it tends to be more female children that exhibit problematic sexual behavior, but it can be both. While many kids who've, well, actually, I should say, while some kids who have problematic sexual behavior may have been sexually abused, many have not. And in fact, most children who've been sexually abused do not go on to have problematic sexual behavior. So the research suggests that many factors can contribute to developing problematic sexual behaviors. I want to stop for a minute and just let you guys know that I did make these slides a bit wordy on purpose, and that's because these are going to be uploaded for you to review later. And since we're using this format and I can't give you handouts and things like that, I did make them a little bit more wordy. So, you know, just bear with that a little bit, but it is really for your benefit later on. So some of the factors that impact if a child, you know, could develop problematic sexual behavior, one of them comes from family sexuality patterns. So a lack of privacy in the home. You know, we have families where, you know, people are constantly walking in on each other in the bathroom. You know, maybe there's, you know, sometimes no doors in the homes, and there's a lot of exposure to private parts of each other. We do see that a lot. We also see situations where there's sexual behavior by adults in front of the children. That also, you know, could be a motivation for problematic sexual abuse or sexual behavior. And then, of course, we also see a lack of incest taboo at times in these families. And what I mean by that is families where maybe, you know, cousins have sexual relationships, and so, you know, kids grow up to believe that that's maybe a normal behavior. So we do see lack of incest taboo in these families at times. Some of the other contributing factors, exposure to sexual material, and yes, somebody chatted that a question along the way. This one is huge. We are seeing an explosion of children accessing internet pornography at alarming rates, with early average onset about age 9. So if you can imagine a 9-year-old, you know, beginning to access pornography, and then what that might look like 9 years later when they're 18 in terms of how that shapes their sexual development, obviously that is, you know, very concerning. So I would say that's predominantly what we're seeing right now is, I would say almost all of our kids who come in with problematic sexual behavior and our adolescents who come in with illegal sexual behavior, they are accessing internet pornography, more so than any of these other behaviors. Exposure to family violence is also a motivation. So witnessing domestic violence, physical abuse, those things, you know, kind of pairing that sexuality with physical violence. So if you have exposure to domestic violence, and you might see maybe your parents engaging in sexual behavior in 1 minute, or even, you know, being loving and kind to each other, but then the next moment there's, you know, physical aggression. That gets very confusing for kids. And so exposure to family violence is also a motivation, and physical abuse. And then other non-sexual behavior problems. So we do see a high correlation of kids with problematic sexual behavior who are on the autism spectrum, and also who have ADHD. These things are linked, you know, with lack of impulse control. Poor social cue reading is also common. So we do have a lot of children who have co-occurring mental health issues. In terms of when I was talking about access to sexual material, about whether it was sexual abuse images or what people call child pornography or adult pornography, most of these kids are viewing adult pornography. we're not seeing as many kids looking at sexual abuse images of children, but certainly there are the situations of, more of this is the 7 to 12 range, but, the older adolescents, might be, asking each other for inappropriate photos. So that would fall under sexual abuse images. Okay, we're going to move on to the next slide. This is developed by the National Center for the Sexual Behavior of Youth, and it's kind of just a visual of what we were just talking about, some of the motivational factors. You have the child vulnerabilities, behavior problems, developmental and verbal delays, impulse control problems. Then you have the family issues, factors that might hinder parental guidance and supervision. So like if you have a parent with drug and alcohol misuse, they may not be able to provide adequate guidance and supervision. So that would kind of fall over in that area. Modeling of coercion, that's what we were talking about with the domestic violence and the physical abuse, or even it could be peer or community violence as well. Modeling of sexuality, sexual abuse, being exposed to those kinds of things, even witnessing sexual abuse of siblings. So these are all some of the motivations for children who develop problematic sexual behavior. Okay. So you'll see as we go through these next few slides that children with problematic sexual behavior are very different from adults who sexually offend. Children tend to be more impulsive, driven by opportunity, experimentation, poor social skills, where adults who sexually offend tend to be more compulsive. So children are impulsive, adults who offend tend to be more compulsive. So that's an important distinction to keep in mind as we go through. So children as young as 7 months may touch and play with their own private parts. So that's developmentally appropriate. You see this happen when, changing a baby's diaper. Infants and young children, they'll self-touch, but it's largely related to curiosity and self-soothing. So even at times we've had people come in and be very upset, feeling that maybe their 2-year-old has been being sexually abused because the 2-year-old is rubbing their private parts frequently. And, most of the time that's what we're talking about here with that self-soothing or curiosity. So they realizing, when they rub or touch themselves that might feel good, but it's not necessarily an indication that their child is being sexually abused. Again, we're going to focus on the 7 to 12-year-olds as we go along. The other thing I just wanted to add about children, and in terms of how they're different from adults who sexually offend, or even older adolescents who sexually offend, is that children are more present-orientated. So they don't tend to think about what the long-term consequences of their behaviors are. So that's something to think about too as we progress through these slides. So what is developmentally appropriate? So it's important to understand what is developmentally appropriate so that we can then, really get to what's the problematic behavior. So game playing, you'll see kids who will, people will say, you show me mine and I'll show you yours kind of thing. That's pretty developmentally appropriate. And it doesn't mean that you don't intervene in these incidents if you see them, but it is appropriate. So you may still have to set an intervention around it, but it's not necessarily something to be alarmed about. Kids will seek opportunities to see each other's private parts. They're curious, especially when they realize that there's a difference between boys and girls' private parts. So they might wonder, well, why? Why is that person's different than mine? And then they might want to go on to say, I need to know if, all my friends have different private parts or things like that. So you'll see things like playing doctor, who can, pee further, that kind of thing. So they also may continue to ask questions about reproduction and want more details. So we always say to caregivers that we're working with that if your child asks you these questions, it's okay to give them a response that's accurate, but it could be limited information. So I'm seeing some things along the side that people are seeing me freeze. Okay. So if a child comes to you and asks you, where do babies come from? You you don't have to go into a whole long detailed description. They just want to know a little bit of accurate information, and then they kind of go on their way. But that's normal. That's a normal reaction. They have developed conceptions of privacy, and privacy needs begin to increase at this age. So I would say like around 8 or 9, you start to see children, they want to, be alone in the bathroom. They want to bathe themselves. They want the door closed. These are normal developmental things that we hope to see happen. So all of that is normal. They may have a crush on another child, which typically does not involve sexual feelings. And a lot of times if you press them and say, well, what does that mean that so-and-so is your boyfriend or girlfriend? And they'll say, I don't know. That's just what I heard. Also very normal. They imitate or verbalize with what they've seen or heard on TV from, models such as singers, actors. And they do have more exposure to the media than we do. So they are seeing more things. We call it the Scooby-Doo syndrome. Scooby-Doo's been around for a long, long time, and so you can almost see the changes that have happened in terms of sexual development over the years. When I was a kid, Scooby-Doo and all his friends, they all hung out together, and you kind of thought, oh, Fred and Daphne are kind of cute together. They'd make a cute couple, but they never made them be a couple in the show. Now, on newer Scooby-Doo shows, you'll see the clothing is, different, tighter, more revealing. They are boyfriend and girlfriend. So it's interesting what kids are subjected to nowadays, and we have to keep that in mind that there is a lot of exposure in media. Keep in mind, too, that there's a lot of sexual themes in television shows, even shows geared towards children. So, when I was a kid, it was very, very rare to see teenagers kiss in a television show, and now, they're having sex in television shows, and this occurs on channels for children, Nickelodeon and Disney. Okay, so typical sexual behavior or sex play is part of normal development. So how we know it's normal is we look at things like, is it exploratory? Does it appear to be about curiosity? Is it spontaneous and happens without planning or notice? So all these things would make the behavior, if you're trying to decipher if a behavior is problematic or normal, being exploratory in nature, being spontaneous, being intermittent, where it only happens every once in a while. The children are of equal age, size, developmental stage, and they're mutually agreeing. It doesn't associate with strong feelings of fear, anxiety, or sadness or anger. So like one child is not, pushing another child or coercing them. The child who's also responding to the sexual behavior isn't afraid or isn't feeling distressed. Those things would all make it normative. Again, I want to point out, it doesn't mean you don't intervene in the behavior, but it means that it may not rise to the level of being problematic. Most of the time, things that fall into the normative realm, it's not discovered by adults. And it also has nothing to do with a child's sexual orientation later in life. So this is a very big stressor for parents who do find their children engaged in what would be considered normative sexual development with a peer. Maybe it's 2 male children who the parents have discovered engaging in this behavior, and they're worried that their child, is going to be, gay later in life. And it has nothing to do with that. Again, we're talking about curiosity and exploration at this point. Okay, so signs that behaviors are beyond what is typical. So now we're going to start kind of looking at what is problematic. So when the behavior is frequent and excludes normal childhood activities, this is beginning to get into the problematic range. So an example of this is we have a 12-year-old boy who excessively masturbates. And he chooses this activity over everything else. He doesn't want to play video games. He doesn't want to hang out with his friends. He doesn't want to watch TV. This is what he wants to do. he leaves the evidence of his masturbation behind for adults to clean up. And he becomes aroused when looking at his stepmother and draws her attention to that arousal. That would be problematic because he's making other people uncomfortable with his sexual behavior. The difference would be a 12-year-old boy who's masturbating behind a closed door, like a bathroom, and locks the door, and nobody ever knows, he's doing it. That would be normative behavior. So that kind of gives you a little idea of how one kind of goes over to the what's beyond typical. So the next one, the behavior does not decrease even after the child has been told no and given consequences or has been given praise for choosing other activities. So here's where I kind of want to just bring everyone's attention to, intervention, initial, when this behavior is discovered. So if a child is discovered to be engaging in problematic sexual behavior, you do want to give them an opportunity. And we're talking about not really intrusive sexual behavior. But if a child is discovered to be engaged in sexual behavior, and this is the first time it's been discovered, you want to sit down and talk with a child and help them understand why their behavior is wrong. Kids don't always know that this behavior is considered wrong and could be illegal and could get them in trouble. So having a conversation with them about why the behavior is wrong and what could happen if they continue the behavior is a good opportunity to give them. But if the child continues the behavior after that discussion, then you're now running into more problematic sexual behavior. So an example of that is, a 9-year-old boy was found by a parent to be touching the private parts of a peer-aged child. Both boys were spoken to about their behavior by their parents. They were explained why the behavior was wrong. The parents had heightened supervision when the two children played together. Both boys had agreed that the 9-year-old was the one initiating the behavior, so the parents were supervising. But after a little bit of time, supervision started to slip. They thought it was just a one-time thing, the parents, and that the kids would be fine playing together. And so when they stopped supervising, the 9-year-old initiated the behavior again. So at this point, you now have problematic sexual behavior because the behavior is continuing even after it's been discussed and even after heightened supervision. We're going to get into this a little bit further, but it's also liability now on the parents because they lessened the supervision. So we're also going to talk about what that means later on. So some other things that are beyond what's typical, the behavior is harmful or potentially harmful to the child or other children. So in the case of the 12-year-old boy who was masturbating, he was actually causing himself physical injury at times. So again, that's moving over to the beyond what is typical. If the child coerces or forces others to participate, that's clearly beyond what is typical. And an example of that is an 8-year-old tells a 5-year-old neighbor boy, an 8-year-old female tells a 5-year-old neighbor boy that she will not be his friend unless she can look at his private parts. That's coercion, so telling another child, that they're going to get them in trouble or not be their friend, or they can't have, some toy that they want unless they do it. Those are all things that would be considered problematic. And it happens between children of significantly different ages and developmental abilities. So again, I want to go back to the normative behavior, which is that they will typically choose people, other children of their same, size and developmental disability in the normative range. Okay. So a child who has greater knowledge than other children for their age about sexual behavior, so that could be a sign that there's problematic sexual behavior. So we once had a family in our program, and the 7-year-old boy had exhibited problematic sexual behavior, and the mom was kind of in denial about it, and we were teaching him about normal sexual development and sex education. She was very upset. She felt like that was too much information for his age, even though he'd already exhibited problematic sexual behavior. And then he had the opportunity to ask any question he wanted about sexual behavior, and he turned to his mom and asked her if she knew what a Magnum condom was. And that mother almost fell out of her chair. But again, this was a 7-year-old who knew what that was and wanted to, let his mother know that he had all this information. So that's a child that would fall in that range where he had more knowledge than what he should for 7 years old. If you have a child who is overly interested in sex to the exclusion of other activities, that's an indication of a problem. The child engages in sexual activities with children that they do not know well. So again, remember, I want to remind you how normative sexual behavior would involve kids that they know well. Typically, they even know to stay away from siblings and people in their family, and they'll choose peers. So this would be a child who would, really try to engage any child in a sexual behavior if they have the opportunity. A child is involved in sexual activities with a much older or much younger child, and when a child, again, uses force, coercion, or bribes to engage another child. So those are all problematic. Let's see here. So how and why do we report problematic sexual behavior? So this is always something people will have a lot of feelings about. New York State law does say that any child over the age of 7, so 7 and up actually, can be charged with sexual behavior problems. So it is not uncommon for us to get children into our program who have been charged by law enforcement. What I will say about that is the family court system is meant to be rehabilitative and help these children get into correct services. It's not meant to be punitive, and it's not meant to cause them severe consequences like it is in in criminal court. Again, the ages is 7 and up in New York State can be charged. That was a question in the chat. So there's a couple ways that this can be reported, and then we're going to talk about why. So obviously you can make a report to the New York State Child Abuse Hotline. When that happens, obviously we're mandated reporters, most of us, so we do have to report. When you make a report to the Child Abuse Hotline, if the parent was unaware that their child had this problem, typically they will not take the report for abuse by the parent, but they will make a law enforcement referral. If the parent was aware that their child had this problem and was failing to supervise or failing to inform other adults of their child's problem and allowed, let's say they allowed the child to go to a babysitter who cares for other children but didn't tell the babysitter that child has this problem, and the child acted out sexually at the babysitter's, the parent can, that would be a state report on the parent. And then also it could even bring legal charges to the parent for endangering, for not protecting the children. So there's a whole lot of things that go along with this. Contacting law enforcement, so child-on-child sexual abuse is typically a law enforcement report. However, you usually can't make the report if you're the provider. Typically it has to come from a plaintiff, a person making the complaint. So usually what we do is if we become aware of an incident of problematic sexual behavior, we will encourage the parent of that child to make the report. And you can imagine how difficult that is for a parent to hear that they need to make a report on their own child. And what I say to them usually is, there's reasons why this is done. One, you want an investigation to determine who's all involved. Is there an adult involved in this sexual abuse? What children are being impacted? Are there other child protective issues going on in the home? Because, a lot of times there are. We also will talk to the parents about how they're helping their child by making this report, because they're getting the child the help that they need, and they're helping their child understand that this behavior could have long-term consequences if it continues in the future. But it's not an easy conversation to have with parents. So if you're uncomfortable having that conversation with parents, I would encourage people to reach out to the people in their communities who, are able to have these conversations, or to just go ahead and make the New York State Child Abuse Hotline report, and they will make the law enforcement referral. I will tell people that when I have that conversation with parents, I do tell them that I need to follow up with them, to make sure that they've made the report. Otherwise, I will have to go ahead and call in a state report because I am mandated by New York State to do so. But I do want the parents to feel empowered and have that opportunity to be protective of their children on their own. So it is a difficult thing to do, but it is necessary for there to be a law enforcement investigation. And it's also important that we remind ourselves as providers that we are not investigators, and that in fact we could actually really do a lot of damage to a case and to families if we try to investigate things ourselves. So the other thing that we typically see, we actually see this a lot, is there's concerns that there's a lack of perceived need for treatment or intervention by the parent or parent minimization. So obviously, any type of sexual behavior is a taboo subject, and parents really, really struggle when they learn that their children have problematic sexual behavior. A lot of parents want to believe that it will just go away or that it was a one-time thing. And so we run into a lot of problems with them feeling like there's not a need for treatment. There's not a need for intervention. I don't want people to know. And that's going to be a really, really dangerous area. The other reason to make the report and have this all looked into is it does provide a safety team around the child and the family. So we work very closely with places like probation. We work with our county attorney very closely. We work with the family, social services, whoever's working with the kids, the school. We're all working together on this. And it also strengthens the external controls to help the child. So again, it reminds the child, or at least teaches them, that behaviors have consequences, and you can't just do things that are illegal or wrong without consequences. So it does let the child know that the behavior is being taken seriously by the adults in their life. Okay. So what do children with problematic sexual behavior need? So they generally have poor internal control. So their internal decision-making systems aren't working well right now. So we need to help them by strengthening all the external controls. And these are things like rules, supervision, helping them to build up those internal controls so that they can make better decisions for themselves as they get older. And it has to be enforced by responsible adults. So things like rules help ensure safety. And so when a family starts with us, we do a family safety plan with them. And it's not to punish the child. And in fact, the way we explain it to parents is it's there to help your child develop those internal controls and also to help them be protected so that if they're following all the rules, someone can't make an allegation against them again and say that they're maybe alone with a child. If the parent is following rules of supervision, then, it's unlikely sexual behavior could occur again. So heightening supervision is probably the number one thing to do to prevent continued sexual behavior problems. So once the child develops the ability to control those impulsive and problematic behaviors, typically with therapy, rules can be reduced. So these aren't lifelong rules. These rules are in place as long as the child needs them and the family needs them to be in place. And an adult's involvement in treatment is essential. And we're going to talk about that a little bit more. So safety planning. Again, I was talking about the family safety plan. And if you go back to those original beliefs that people have about this population, we're going to talk about one of them now, which is that children with problematic sexual behavior actually can remain in their home. So there's a widely held belief that they cannot stay in their home and they cannot live with other children. But with proper safety planning and supportive caregivers, they actually can be very successful. and it's actually research shows more beneficial for them to remain in their home or at least in their community. So in some situations, they may not be able to remain in their home, which we're going to talk about that in a minute. But even remaining in the community with another, maybe a family member or something like that, is actually more beneficial than sending them away or placing them in residential treatment. So in our program, we don't just work with the child. As I said before, we work with the entire family. So caregivers are required to participate in our program in order for us to see their child. We do a complete mental health assessment of everybody who comes into our program. And having the caregiver involved is going to be the key to developing an adequate safety plan. And really, the long-term benefits of the caregiver being involved are going to be enormous. In order to do this, though, and part of why the assessment process is so important, is you have to have a parent or caregiver, because it's not always a parent. Sometimes it's a foster parent. Sometimes it's a grandma. I mean, we've had all different scenarios. Sometimes it's both. You have to have a caregiver who believes there's a perceived risk of continued problematic sexual behavior, because we want to make sure that they're going to properly supervise. If you have a caregiver who does not believe that their child has this problem and minimizes it greatly, then that parent is likely not going to provide adequate supervision when you're all not in the picture. So that's very important to assess that caregiver's involvement. When you're doing safety planning, you also want to look at the child's environment. You know, how many bedrooms are in the house? Is this child able to have their own bedroom, which we recommend? Is the caregiver able to provide eyes-on supervision? Are there areas of the home that could be a risk because they could be easily secretive or something along those lines? What's the family's rules around privacy, you know, in bathrooms and bedrooms? Like, all these things need to be taken into consideration when you're doing safety planning. The caregiver needs to understand what their liability as a supervisor is. So, you know, we'll say to parents, you know, we want you to understand that by accepting this responsibility, by signing the safety plan, you're understanding your role as a supervisor, and that if you don't properly supervise, there could be consequences to you. You could have additional state reports. You could have, you know, a legal charge of endangering should you not supervise your child adequately. Now that you know your child has this problem, we are very honest with them because we want to be transparent with parents. We want to set them up for success and not failure. So I will say to a parent, and we see this happen all the time, we have parents get charged with endangering because they did not follow safety plans. We don't want that to happen. So we try to be very honest with them from the beginning. Anyone in a caretaking role of the child needs to be aware of the safety plans. So again, if there's a babysitter or somebody else who's responsible for caring for this child with other children, they need to know what they're supervising. Again, we want to set the child up for success, not failure. We require that at least one person in the school be notified of the child's problematic sexual behavior. We typically communicate with the school social worker. We do not recommend that all the teachers and everyone in school know because it really is not necessary. Typically, the social worker is who we communicate with. And that's also to help the child, too, because we want to know how the child's doing at school. We want to make sure they're not having sexual behavior problems at school. And, again, we want them to be safe when they're at school. There's a question along the side about the police report. Yes, 7 is the youngest. You would make a police report. They would not accept a report on a child who's younger than that. Let's see. So just to go back to the, you know, when we can't serve a family in community-based treatment, you know, if we have a caregiver who, again, won't follow the rules, you know, refuses to sign the safety plan, doesn't feel their child is going to continue the behavior, maybe if we have concerns about the parent's stability or drug and alcohol misuse, which would, you know, could lead to poor supervision, That's a case that typically we're unable to keep in the community-based level, and that could result in a recommendation for a placement. Or if we have a child who is unruly in other ways, who has shown continuous pattern of behavior where they will not follow rules or listen to the adults in their life, then that might be a child that we can't serve on the community-based level. Or if they're having other unsafe behaviors, being physically aggressive to the other people in their home, things like that have to be taken into consideration in the assessment process of whether a child can remain at a lower level of care. I will tell you these things are very rare for us. It's very rare that we are not seeing a child at the community-based treatment level. So we're going to move on to some treatment topics. I'm not going to go into a lot about the specifics of treatment. I will tell you that we've been treating this population. So I've been the director of this program for 6 years, and I've worked in this program for almost 20, and we've always treated this population. But we've changed over the years to more evidence-based treatment. We use the Oklahoma model, which is the problematic sexual behavior cognitive behavioral therapy model. It is evidence-based, and they have put all the research behind it, and that's what we choose to use. And I will say that we have seen great success with that program after we switched from a more generic type of program. It's more structured. And the caregivers have to be involved, which is not something we did before, but it is so beneficial to have them involved. So in our program, what the caregivers learn, so the caregivers actually come to a group at the same time as the kids, but they're in different rooms, and then they come together for the last half hour, 45 minutes to review the information together so that we can make sure the caregivers are able to implement this stuff at home because we only see kids 1 day a week, and they have their kids all the time. So it's important that the caregivers really work on helping things in their own environment. So they learn about things like supervision, expressing their feelings, coping techniques, self-control strategies, lots of parenting information, behavior management plans, promoting pro-social interactions with the children's peers, managing peer pressure, sex education, abuse prevention, and learning to praise their children. So, a lot of these things are a lot of things that you would teach parents in a parenting class. We make it specific to children with problematic sexual behavior. And what we find, interestingly, like when we do the sex education topic, the parents are way more embarrassed than the kids are, have a way harder time than the kids do. And again, that speaks to how much information kids are being given through media these days about sex. And they know a lot more than we think they know. So the parents often are very happy that we're doing that topic with them because a lot of times they'll say, I didn't know how to talk about this with my kid, and I probably would have underplayed it instead of like going into so much detail like we do. So that's just some of the parenting topics. The children are getting information about sexual behavior rules. So it's not okay to look at other people's private parts. It's not okay to touch other people's private parts. It's not okay to show my private parts to other people. It's not okay to make people uncomfortable with my sexual behavior. It's not okay, or it is okay to touch my own private parts as long as I'm in private. So those are kind of some of their sexual behavior rules that they're being taught. They're learning about feelings identification and expression, coping skills, self-control, a lot of interventions into their behaviors. And a lot of these things will also, it doesn't just help with problematic sexual behavior, it will also minimize any other behavioral problems that they're having. So that's the benefit of treatment. So, what I want to say about children in treatment is that currently we see a lot of kids with problematic sexual behavior being put in programs that are set up for adults, or older adolescents, where they're really focusing on like reducing deviant sexual arousal. And now, what you've all learned is that that's not what kids who act out sexually are about. They're not, usually they don't have deviant sexual arousal. That's not what's happening. So placing them in programs that are really more geared towards adult topics is not going to help them. Also, we see these these kids being placed in general treatment programs where really the focus is on other issues and the sexual behavior is really missed. And then another huge issue is trauma histories are often overlooked. And as we know about these children, they may not have necessarily been sexually abused like people believe, but they have likely experienced some type of trauma that does need to be addressed. And so because a lot of times they're viewed as, perpetrators, and I say it like that because we should never use these words for children. We should never call them sex offenders, perpetrators, anything like that. Those words are reserved for adults. We miss trying to address the real issues, and trauma is often one of them. Let's see. Okay, so, outcomes. So research actually indicates that children with problematic sexual behavior who receive proper treatment, they actually have very low recidivism rates. So one of the myths we hear a lot is, oh, if this child does this, again, they're going to turn into an adult who sexually offends. And in fact, that is not the case at all. And much research has been done around this. With proper treatment, it's 2%. So 2% of kids might go on to, have continued sexual behavior problems. That is a very low number. And in fact, these kids, what we see, they're very unlikely to recidivate sexually. They may go on to have other problematic behaviors that don't involve sexual behavior, but in terms of sexual behavior, it's very low. A child who has a caregiver involved in treatment is going to do much better in the long run. Close supervision, open communication with the child, which is why that's a topic that we work on with the caregivers and the kids together. Developing positive social relationships. These are all protective factors. So with these kids, you want to heighten things like peer interactions that are pro-social. That's going to help them do better. The 2% recidivism rate question along the side is, am I talking about 7 to 12 years old? Yes, I am talking about 7 to 12-year-olds. In terms of adolescents, it's actually really low as well with proper treatment. So I think it's something around 5% for recidivism rate with proper treatment. So, we also serve that population, and it is also really low, lower than people expect. See here. So again, I want to highlight that offending as a child is not a predictor. So not a predictor for adults sexually offending as an adult. They are not predatory in nature. They are driven by opportunity, experimentation, and poor social skills, and sometimes the need to reenact their own abuse. So here's the takeaways I want you to think about, and then we'll do some questions. PSB can come from many factors. It doesn't necessarily mean the child has been sexually abused. Some have been, but many have not. But many do have some type of trauma history, whether that's being, exposure to domestic violence, physical abuse, neglect. It could be another form of trauma. Children with problematic sexual behavior need appropriate interventions that strengthen the protective factors. Proper safety planning and caregiver involvement are going to be the main things that help these children remain in their homes, which is going to give the best outcome. Caregiver involvement is probably the strongest protective factor and probably the most important. So if you're working with these kids and you're not including the caregiver in treatment, then you probably are failing the child and the family. And I hate to say it that way, but that's what the research shows. Having a caregiver in treatment where you're addressing the environment is going to be ideal. Recidivism of problematic sexual behavior is very low, and most children with problematic sexual behavior do not grow up to sexually offend as adults. Here's some resources that we use. There's lots of information out there in terms of working with this population. The Association for the Treatment of Sexual Abusers put out a few years ago some guidelines for working with children with problematic sexual behavior, so that's good to look at if you're thinking of this work. All right, so is there any questions?
Thank you so much, Amy. This is a wonderful presentation. And we do have a few questions. So to start, someone said, I'm treating a 3-year-old who was alleged to have been sexually abused by a 12-year-old uncle. Parent reached out to the New York State Child Abuse Hotline, and I as well. We were told initially that they would not take a report stating it was a child on child, that it was minors. ACS is involved, and both children are receiving services. Do you have any thoughts there?
No, it doesn't surprise me because, again, if the adults weren't aware prior to this that there was problematic sexual behavior, it would not rise to the level of a state report necessarily, because the state report would only come into play if the parent was aware and did nothing to prevent it. So if it happened, and the parents didn't know or whatever, it would not be necessarily a state report.
Okay, thank you. Hope that was helpful. Someone said they're curious about how you would explain to a parent if their child engages in the PP game with their peers. What if the child is 5 and engages with a child who's 10?
So I would want to know who initiated that, because that's a pretty significant age difference between the two children. So I would want to know, whose idea that was. If it was the 10-year-old, then, I would want to understand that a little bit more about what's going on with that child. But I would say if you're the parent of the 5-year-old or the provider of the 5-year-old, I would explain why that behavior is not okay and how that could get people in trouble. And then just I would make sure that I supervise both children's interactions or with other children even.
Great. Thank you so much.
Can I speak to, there's a question about the percentage. Someone said overall rates of recidivism for youth with PSB is 7%. So it's much lower. The research for the recidivism rates is still ongoing, and there's actually another study that's they're still doing the follow-up on, and they're suspecting it may even be lower with particular types of evidence-based treatment interventions. So there's good news, too, with that.
Great. We do have a few more questions, if that's okay. We actually have a lot of questions that came in, so thank everyone for sharing your thoughts and your questions. Someone asked about a safety plan template. Do you have one that you could share or one that you would recommend?
I have to look and see if I can share it, but I might be able to.
Okay, so I'll be in touch about that, everyone.
Okay.
If that works. If not, maybe we can figure out how to get that. That's a really great question, I think, and really important as per this topic.
I can speak to a couple specifics to think about. So not only do you want to make sure that the children have we always recommend their own rooms, but of course, families don't always have that ability to do that. So things are used like door alarms. We have families who might use a baby monitor in the room or something like that. What you don't want to do is be dependent on cameras, because cameras don't stop the behavior from happening. They just let you know that it did happen, so that we always kind of encourage people to be careful about that. But eyes-on supervision is going to be the best thing. It's the nighttime stuff when there's other children in the home that, require some creative work.
Great, thank you. Okay. People are bringing up their own kind of cases and some of the real challenges they're having, and it's making me wonder if there's some other support we could give everyone. It sounds like everyone can relate to everything you're talking about and have their own challenges. So I'm just going to share one, and then maybe we can talk about something in the future. So any suggestions on a 14-year-old who watches porn, has asked someone for nudes, has joined FB groups, including Ukraine and Russian brides. There have been talks, workers involved, safety plans in place, even had officers talk to the child. Nothing is working. I even looked at the school Chromebook. This has been an issue for about a year.
Yeah. So this is a huge issue that we hear a lot about, because the access to the internet is so easy for kids to get nowadays. I mean, we have kids who, they know more about technology than we do, so they'll go in, to their parents' rooms and use old phones and hook it up to the Wi-Fi and do all kinds of things. I mean, the best thing to do is to restrict the access the best you can. We will instruct parents to do things like change the Wi-Fi password on a regular basis so the kids can't access it. I mean, nothing is going to be foolproof, but you're just trying to minimize it. Take the electronics away. We have lots of parents who say, but it's their phone and I can't take it away. Yes, you can. And especially if it's harming your child, like sometimes those are the things you have to do. We worked with schools, and it's really hard right now during COVID and kids being on web-based learning to say, you know, listen, if this kid can come to school instead of using the Chromebook, like we might need to do that because they're, you know, they're having too much of a impulse to look at, you know, the internet. So, you know, nothing is foolproof, but the best thing to do is restrict the access the best that you can.
Okay, great. I think this question is really important as well. How do we address the stigma around problematic sexual behavior? Well,
I think what we say to parents is, you know, your child has a problem, that there's a light at the end of the tunnel. So we remind parents that, you know, no research shows us that your child is going to become an adult sex offender. And honestly, that's their biggest fear. And that's what stops them a lot of time from reporting it, because for so long, that's been the myth that's been out there, is that if you have a kid who's acting out sexually, they're going to offend. You know, once you become an offender, you never stop. That's what people hear. So you have to reduce that stigma and help them see that with proper intervention, that this is a treatable issue. These children can go on to have perfectly normal lives. Even if they have legal intervention, those records in New York State are sealed. So it's meant to get them the help that they need, and it doesn't have to follow them forever as long as they get the proper help.
Great. I hope that was helpful. So many questions. You just did such an amazing job, and I think this is a real indicator that people would like some more information. One question is around the name of the treatment that you talked about.
We use the Oklahoma model, which is problematic sexual behavior, cognitive behavioral therapy. They have several different models for one for preschool age children, one for the 7 to 12 range, which we talked about today, which we identify as problematic sexual behavior, and then for 13 and to 17, for adolescents, we identify that as illegal sexual behavior, even though the problematic sexual behavior can also be illegal. That's kind of how we decipher them. But they do have 3 different programs. They have a website, the National Center for the Sexual Behavior of Youth, which was up on the screen. They do have a wealth of information in there for providers. So I would encourage people to check out their website. And then also ASSA, the Association for the Treatment of Sexual Abusers, also, like I said, has guidelines out for treating children and adolescents with this issue. So that's a good thing to take a look at too.
Wonderful. And Fung is chatting in the website that Jenny just mentioned as well, so that you all can access that. It's fantastic information. I also know the wonderful people at the University of Oklahoma, and they do amazing work. So thank you for that. Do you know of any, somebody asked, do you know of any agencies or organizations in Manhattan that use this program?
I don't, unfortunately. I think there is one in the Bronx. But I don't have the name of it off the top of my head.
Okay, maybe we could chat about that, and we could send that around when we send out the slide when they're uploaded or something. I'm actually wondering. So I think we have time for one more question, or maybe 2. Someone asked, "Does calling law enforcement mean calling 911?"
No, I would encourage you to just call their front desk, and it actually wouldn't be you calling. It would be the caregiver. So you would want the caregiver to make their own report. And I sometimes will just either tell them just go right down there and speak to someone, or, with COVID, that's a little bit difficult. I will just give them the number to, they all have like a front desk number, but 911 would not be necessary unless there's like an immediate incident happening where you need someone to immediately, step in.
So the front desk of the precinct?
Right, of whatever. So it would have to be where the incident occurred. So you would have to know, where the incident occurred. And if you're unsure, then I would recommend contacting either state police because they have a bigger jurisdiction or the county sheriff's office.
Great, thanks. So only 911 if it's a dire emergency.
Right.
Okay. And I think one last question is, how do you really help a parent who's trying to get help for a child with problematic sexual behavior and no one takes them seriously?
That's a difficult one because that sometimes happens. We just encourage the parent to continue to advocate for their child. We always tell children, too, who make disclosures of abuse and they don't feel like people are listening, keep telling. So the same kind of thing, we would just say to the parent, if you feel like this is really an issue, then, keep asking for the help that you need.
Thank you. Thank you so much, Jenny. We're wrapping up. It's 1 o'clock. We have some upcoming events, Integrated Care 101, overview and best practices within youth serving organizations, Thursday, February 25th. Hope to see you then. And just thank you so much. If you have any questions, please contact us at ctac.info@nyu.edu. And thank you again, Jenny, so very much for all of your expertise and wisdom and information. We really appreciate everything that you discussed today.
Thank you.
Any last words?
No, good luck.
Okay. Awesome. Okay, take good care, everyone. Bye.